Activase, or tPA, is the only FDA-approved drug for treating acute ischemic stroke in adults to improve neurologic recovery and reduce the incidence of disability. This program will show you the step-by-step process of reconstituting tPA. A septic technique should be used at all times during the reconstitution process. This includes hand washing and the use of gloves. Before mixing tPA, the nurse needs to first assemble and set up all the necessary supplies. The RN will pull out the tPA or Activase kit or box from the Omnicell. The tPA kit includes a 100 mg vial of Activase in powder form, a 100 ml vial of sterile water for injection, and a transfer device. We will also be needing a standard 18-gauge needle. Do not use a blunt or needleless device to avoid creating a bigger hole at the puncture site. This helps prevent leakage of the tPA medication. A 60 ml syringe or a smaller syringe is also needed, depending on the amount of waste. A 50 ml normal saline bag for flush, a regular primary IV tubing, an IV pump, alcohol wipes, and a functional or patent IV access. How to mix or reconstitute tPA medication. Begin by removing the protective cap from the top of the Activase vial and the vial containing 100 ml sterile water for injection. Next, swab the top of each vial with an alcohol wipe to reduce the risk of contamination. Remove the transfer device from its wrapper. Then remove the protective cap from one end. Insert the piercing pin vertically into the center of the stopper of the vial of sterile water for injection. Next, remove the cap from the other end of the transfer device. Holding the Activase vial upside down, position it so the center of the stopper is directly over the exposed pin of the transfer device. Push the Activase vial down into the transfer device, making sure the piercing pin is at the center of the stopper. Invert the two vials and allow the entire contents of sterile water to flow down into the vial containing Activase powder. Remove and discard the empty vial and transfer device into the sharps container. Mix the solution with a gentle swirl or slow inversion. Do not shake. Then, allow the Activase solution to stand undisturbed to allow big bubbles to dissipate. Slight foaming might be expected. Activase will remain stable for up to 8 hours at room temperature after reconstitution. Do not freeze Activase solution. Inspect the Activase solution for any particulate matter or discoloration before administration. No medication should be added to Activase infusion or solution. tPA dosage calculation and administration. After mixing the tPA solution and inspecting it for any particulate matter and discoloration, we are now ready to calculate the treatment dose for our patient before the actual tPA administration. tPA solution, by the way, is colorless and may appear pale yellow. The recommended treatment dose of Activase is 0.9 mg per kilogram body weight, not to exceed 90 mg total treatment dose. And so, patients who weigh 100 kilograms or more will receive the maximum recommended total treatment dose of 90 mg. The desired amount or dose to be given will then be infused over 60 minutes. To ensure proper dosing, discard first excess amount by removing any quantity of drug in excess of that specified for the patient's treatment. In this video, we will use a 150-pound patient as our example. tPA dosing uses kilograms and not pounds. And so, using the provided tPA dose calculator, a 150-pound patient is 68.2 kilograms in weight. The discard dose is 38.6 ml. Bolus dose is 6.1 ml, which is 10% of the total treatment dose. The remaining 55.3 ml is the actual dose to be infused and given in 60 minutes. Confirm dose with the second RN, scan your med, and document in Cerner. Note that there are two ports on the stopper of the Alteplase vial, the center port and a small keyhole port. To start, wipe the top of the vial with an alcohol swab. In this video, we use two 20 ml syringes to remove the excess amount, which is 38.6 ml. 38.6 ml is our waste amount for our 68.2 kilogram patient. But of course, if available, you may use a much bigger 60 ml syringe to withdraw waste amount. Next, insert the standard 18-gauge needle into the keyhole port. Do not puncture the needle into the same hole as the transfer device. This will cause leakage. Also, do not use a blunt needle or other needleless device to avoid creating a bigger hole at the puncture site. This will help prevent leakage of the tPA medication. Do not blow air into the vial with a syringe to prime it. This is to prevent creating big bubbles or foaming of your tPA solution. Foam or bubbles might cause problems with the IV flow when tPA is being infused later on. Another important thing to remember is to remove discard dose first before the vial is attached to the primary line or infusion set. Discard the excess or waste amount into the blue bin. Again, swab the top of the reconstituted tPA vial with an alcohol wipe. Then remove the infusion set from its wrapper. Roll the clamp of your IV tubing down to close it to prevent free flow of your tPA solution and air in the tubing. Also, open IV tubing vent. Remove the protective cap and insert the spike of the infusion set through the center of the stopper of the reconstituted Alteplase vial. Fill the drip chamber. Peel the clear plastic hanger from the vial label and hang the Alteplase vial. Slowly open the clamp and cautiously prime the infusion set. Make sure no medication is wasted during priming. When priming is done, attach the line to the Polaris pump, and we are now set and ready to program the IV pump. After turning Polaris pump on, choose Channel Select, then go to Main Screen, select Guardrail Drugs, and look for Alteplase. Then select based on patient's weight, either stroke less than 100 kilograms or stroke more than 100 kilograms. Select blank milligrams per blank ml and enter total dose concentration calculated based on your patient's weight. Confirm drug setup. Select yes. Enter your patient's weight in kilograms. Select next. Rate will automatically populate based on weight. Next, enter volume to be infused. Important, do not start infusion yet. Go to bolus at the bottom of the screen. Select bolus first. The bolus dose is auto-calculated based on entered patient's weight. Confirm, then select start to begin bolus infusion. The hour infusion dose will automatically start after the bolus infusion is complete. Stay close to your pump near the end of the infusion. When the vial of tPA is empty, but there is still medication in the drip chamber tubing, spike a bag of 50 ml normal saline. You must connect the tubing to a bag of normal saline in order to continue infusing all medication in the tubing. Remember, there will still be approximately 20 milligrams of medication in the tubing once the vial of tPA is empty.